Okay, who's ready for a diarrhea of information? In this sketch, we're going to learn all about antidiarrheal agents. Come join us back in the spa. Take off those muddy slippers and get ready for a Mutopia massage like you've never had before. Before we get down to business, let's briefly define what we mean by diarrhea. Diarrhea is loose or watery poops happening 3 or more times a day. Hence, we've got lots of checks and 3 mysterious splotches on this bathroom cleaning schedule. Diarrhea happens because one of two things in your gut is out of order. Either the bowel isn't absorbing enough water, or the bowel is actively secreting water. Acute diarrhea is usually caused by infection or contaminated food or water. Chronic diarrhea, on the other hand, is primarily non infectious. It tends to be caused by functional disorders or systemic illness. Thankfully, there are drugs to help manage both acute and chronic diarrhea. So let's get started. Here at Mutopia, we kindly ask you to leave your poo mud at the door. You will find we have all the modern accommodations and a ton of antidiarrheals to choose from. One thing to keep in mind, though, is that antidiarrheal agents are treating a symptom, i.e., diarrhea, so you still have to address the underlying process and manage accordingly. Also, please remember that these agents should not, we repeat, should not be used in patients with bloody diarrhea or fever, hence the red stool and flaming candle here. In these situations, the underlying inflammatory, infectious, or traumatic process needs to be managed first. One way to approach diarrhea is through adsorption, represented by this absorptive sweeper. Bismuth subsalicylate, often known as that peppy pink stuff, is both antimicrobial and anti-secretory. And let this travel poster here remind you that bismuth subsalicylate is commonly used for traveler's diarrhea. Roam if you want to, but if your ship hits the fan, don't say we didn't warn you. Remember to watch out for salicylate toxicity and avoid using this in pediatric patients with a flu-like illness because the salicylates can possibly cause Rye syndrome. Last, there is a kind of funny side effect to watch out for. Bismuth can cause you to drop some blackened stools. This can actually be confused for dark blood, melena. So be sure to get a good history and do a thorough exam. All right, on to the star of our antidiarrheals, the opioid agonists. Notice that the name of this massage parlor, Utopia, kind of a little bit, tiny bit sounds like opiate. And our mu-sus should remind you of the opioid mu receptor specifically. Mu opioid receptors exist in high density in the GI tract, and their activation leads to significant constipating effects. They're activated by loperamide, for example, a mu opioid agonist that at therapeutic doses does not cross the blood-brain barrier. Loperamide will be represented by this cute loperamide lop-eared rabbit, part of some advanced massage technique, we guess. They know what they're doing. We'll come back to this concept in a moment. Opioid agonists increase colonic phasic segmenting activity. In other words, the tract squeezes down on stool instead of pushing it along, and this works through modulating the activity of the mucosal and myenteric plexuses. Just think of these two loperamide rabbits, here, lopping back and forth on your colon. The circular rings of muscle kinda squeeze down in succession, pushing stool back and forth in your house strip pouches. Back and forth. Back and forth. This is different than the peristalsis that pushes stool forward and out of the tract to get excreted. This leads to increased colonic transit time and, while your stool just sits there, increased water absorption from the intraluminal contents. Loperamide is a go-to for acute diarrhea, without blood or fever, of course, and also has some evidence for alleviating chronic diarrhea in diarrhea-predominant irritable bowel syndrome. Speaking of IBSD, elaxatiline is a new prescription-only drug. It's represented here by this deluxe massage chair. It works by stimulating mu and kappa opioid receptors and blocking the delta opioid receptors. Selective blockade of the delta receptor prevents the drug from becoming habit forming. And let this classic sketchy pancreatitis sponge here remind you that this drug can cause pancreatitis. So, patients without a gallbladder or those with a history of pancreas or gallbladder dysfunction should not take this drug. Next up, diphenoxylate. Diphenoxylate is a prescription opioid agonist also used as an antidiarrheal agent, represented here by these diphenoxylate dolphins. Again, think of two dolphins hopping back and forth, increasing that phasic segmenting activity. Back and forth, back and forth, keeping your stool from moving along. Low therapeutic doses of diphenoxylate allow for potent antidiarrheal effects without other significant opioid effects, such as euphoria and physical dependence. However, unlike loperamide, at higher doses it can produce morphine like euphoria and physical dependence. Thus, therapeutic doses of the drug are combined with small doses of atropine, represented by Sketchy's own atropine-Alice. If higher than the recommended dose is used, the atropine will produce classic anticholinergic symptoms dry mouth, blurry vision, nausea, etc. And this can discourage abuse. Let this warning sign posted by the fountain remind you that all opioid drugs have potential for abuse, even those marketed as low abuse potential. Abuse can happen because the patient takes more drug than recommended, or patients can get creative by adding on other drugs that could slow the breakdown of the drug or allow the drug to penetrate cells more easily. In general, keep in mind that any opioid agent can cause constipation. Remember the no poo allowed mat here. Patients who require prolonged opioid therapy, therefore, should receive a prophylactic bowel regimen, including increased fluid intake, dietary fiber, and laxatives to minimize constipation. All right, I didn't want to mention this while the other customers were around, but we've actually got some special VIP only accommodations, only for our most valued and hoity toity customers. See the cancer crab? It's our recurring sketchy symbol for cancer, or really any kind of tumor. So let the words VIP and customers stand for VIPoma and carcinoid tumor, respectively. Carcinoid syndrome is usually characterized by an ileal tumor with hepatic metastasis that is secreting a number of biologically active substances, including serotonin. VIPomas are pancreatic endocrine tumors that secrete vasoactive intestinal peptide. So, both of these conditions involve hormone secreting tumors that cause systemic symptoms, including flushing, wheezing, and secretory diarrhea. The octagon shape of the stop sign should remind you of octreotide. Not only that, octreotide is a synthetic polypeptide with effects similar to somatostatin, but with a longer duration of action. So think of that octreotide stop sign bringing hormone secretion and diarrhea to a halt. Octreotide's ability to inhibit hormone secretion and reduce gut motility can be useful when managing a variety of syndromes that cause secretory diarrhea, including chemotherapy-induced diarrhea, HIV-associated diarrhea, or short bowel syndrome. And that's all for antidiarrheal drugs. Now, get out there, travel the rest of the sketchy world, and see lots of shit.